Have you ever tried to change something but failed miserably? Most of us have. Have you ever spent hours and hours trying to convince somebody to try something new, only to have it fall flat? Using the example of how health links are developing across southeastern Ontario, the next few minutes will give you an appreciation for how change actually happens and how you can be the spark that is needed. Okay, be prepared to be shocked by some numbers. In Ontario, just 1% of the population accounts for 1/3 of all healthcare costs. To put this into perspective, that is $15.2 billion spent on the healthcare for only 130,000 people. And only 5% of the population accounts for a whopping 2/3 of all healthcare costs. That's $30 billion. This is simply not sustainable. Last year, in 2013, over 40% of all provincial dollars were consumed by healthcare. In a recent landmark study by Don Drummond, it is suggested that by the year 2030, if left unchecked, healthcare will consume 80% of all healthcare dollars. So where does all of this money go? Well, unfortunately, we have a system that is designed around rescue care. Wait for people to get sick, and then rush in with superb care, technology, and resources in order to try and save them. It's the equivalent of sitting back and watching holes develop in a dam over time, and then when it's about to burst, rushing in with a whole fleet of engineers to try and repair it. Our healthcare system must be fixed, starting immediately. Okay, so that's easy. Get the slides working, fix the healthcare system, no problem, right? Let me ask you a question. How many doctors do you think it takes to change a light bulb? 0. They get stuck on the word change. Now, I'm allowed to say this because I am a family doctor. There is perhaps no other profession in the world that is so resistant to change as is the medical profession. In fact, our training drives into us the principle of do no harm. Reduce the risks. Avoid making mistakes at all costs. And don't try anything new that might harm the patient. Now, this is great for patient safety, but it also comes at a price. Healthcare is slow to evolve, especially around systems of care. What can we do to help doctors and nurses get prepared for and implement change? What can you do in your work and personal lives to help others be a part of positive change? Well, you can. You can be a spark for change in just 5 steps. The first and often bypassed step is to study your environment. You know, kids are terrifically observant. When we as adults are ready to move on to the next thing, they are looking and truly seeing. This is my son on a recent nature hike. And I kept wanting to march on along and get to the destination, but he kept stopping to look, to really look at the world around him. It's important to stop and observe, to see patterns, to see what works, what doesn't, and why. In healthcare, this means taking the time to stop and ask our patients for their perspective. What can they see in the healthcare system that we can't see as doctors and nurses? How would they like the system to be changed? Knowing your environment is an important first step towards change. So what is the state of healthcare in Ontario? Well, unfortunately, too many people get care in hospital when they could be better cared for in the community or at home. Too many people get readmitted to hospital within days of leaving. Too many people have trouble navigating this complex system, and access to primary care is uneven across the province, but also even within communities. We are fortunate in Canada to have a public healthcare system, but there's little coordination or communication between parts of that system. Luckily, there is a healthcare transformation taking place in Ontario. The vision is that in each community, all of the providers and healthcare services will be integrated in a health link. It's an ambitious goal, one aimed at improving patient care and the quality of that care, but also in ensuring a sustainable healthcare system. The problem is we work in silos, which brings us to point 2. In order to be a spark for change, you need to help others develop relationships and trust with one another. Now, this means actually getting out there and visiting people, meeting with them directly. It may take some extra time. You might need a flexible schedule or some extra mileage on the cars. But it's important to get there and see what it is like in their environment. Don't invite them to your meeting. Ask for an invitation to their meeting. Go see what it is like in their setting. With Health Links, this meant traveling the region to see what it is like to practice medicine in a rural community health center or an urban family health team. For you, facing your own organizational challenges, this might mean meeting someone for coffee to see what their perspective is, or visiting each department within your organization. The whole point is to develop relationships and trust before they are even needed. The third step in being a spark for change is leading by example. Now, I know this sounds cliche, but few leaders actually follow it. It's much more common for leaders to go around saying, do this, do that. Many managers use sticks and carrots to coerce people to change. But most change happens by someone having the courage to stand up and lead by example. Children know this, and that change can be sparked by anyone, not just those with power or authority. If you watch kids on a playground or a ropes course like this one, if one kid starts across the rope, you can be sure another will follow. If you are truly passionate about something, have the courage to stand up and role model what it is you want others to do. Okay, so you've surveyed your environment, built relationships and trust, and now you're that lone spark out there trying something new. Now what? Well, step 4 is critical. Amongst the dozens, hundreds, or maybe even thousands of people that you are trying to influence, there will likely actually be a couple of people that follow you. If this happens, ignore everyone else. Focus 110% of your attention on these 2 individuals. Support them, thank them, and recognize them in front of their peers. Experts in change management call this focusing on the early adopters. In any change process, there are different types of people. There are the innovators, those crazy people out there trying new things. There's the early majority, the early adopters, those people who follow closely behind. Then there's the majority, the large group of people in the middle, and finally the laggards, the people who will likely never change, and they will certainly be the most vocal as they criticize your ideas. What most leaders do is make a big mistake. They focus their attention on those that make the most noise. You will waste a ton of time and energy trying to get the laggards to change, and they will still not budge. Instead, your entire laser beam-like focus should be on the early adopters. But why? Because the majority don't follow innovators. The majority follow early adopters. By thanking them, recognizing them, and showing them off to their peers, you now make it clear that it is safe for the majority to be a part of that change process. In each of the 7 health links in the Southeast Local Health Integration Network, there were 1 or 2 individuals who very early on saw the necessity to change. They were thanked, supported, and given strategies and tools to implement that change. Through their pre-existing networks and relationships, they brought others on board. It was because of this, and only because of this, that the number of health links in the Southeast LHIN grew from 1 to 3 to 5 and to 7. A very rapid change process of a complex healthcare system over a couple of months, over a large geography, through a concerted effort to support the early adopters. So what does a health link look like? Well, as you can see, patients and families are clearly in the middle. We have the primary care groups organized and communicating with one another, and there are easy linkages with other aspects of the healthcare team. Hospitals, home care, mental health, addictions, hospice, the list goes on. There are so many advantages of this reorganization of healthcare, such as improved communication, improved efficiencies and transitions in care to and from hospital, and improved and increased patient satisfaction. The fifth and final step in being a spark for change is to foster ownership. Now, not buy-in, but ownership. What's the difference? They sound pretty similar, right? Wrong. Do you remember that really good idea that you had that no one followed? Any idea why? It's because it was your idea, not theirs. You were trying to sell them something. And because people are naturally resistant to change, they often aren't buying what you're selling. No one likes change forced upon them. I don't, you don't, no one does. You have to try a different method if you want lasting change. Try fostering ownership instead. This is perhaps the single most important thing you can do to prepare others to accept and even like change. If anyone is going to be affected by the change, get them involved early in the process to help decide what that change will actually look like. Consult widely. Involve as many people, organizations, and stakeholders as you can. Now, you will have to let go of some control, and things might turn out slightly different than you had imagined, but you will foster meaningful, lasting change. With HealthLinks, we invited doctors, nurses, nurse practitioners, dietitians, case managers, hospital administrators, and most importantly, patients to be a part of this process. They decided what the HealthLink would look like based on their community resources and local knowledge. So now, how many doctors does it take to change that light bulb? All of them, because change isn't so scary anymore. As you sit here today, HealthLinks are doing a number of things. They are identifying complex patients, that 1 to 5% of the population with the most complex needs. They're attaching them to primary care by finding them a family doctor or a nurse practitioner. And they're developing coordinated care plans with each patient, focusing on all of their medical, mental health, and social needs. But most importantly, it's not the Ministry of Health or the local health integration network telling them how to do this. Each community and each HealthLink is coming up with a solution that's right for them, their providers, and their patients. Each of us has passions, dreams, and wild ideas. But most of these never get out of our own head and be put into action. Imagine if you could take one, just one, of your great ideas and see it come true. Well, you can. You can be that spark for change in the world. It might just be easier than you think. Thank you.